Joining me today is Peter Wright, the CEO of Valley Regional Hospital. So Peter, we talked a little bit about the hospital, and sort of some of the things that are causing you to think about. I want to talk about your sort of strategic plan for the hospital.
Sure.
What are the couple of key initiatives, 2-3 initiatives, that you really think are going to drive Valley Regional for the next 5, 7, 10 years?
So I think the important thing to say is the strategic plan is not just for the hospital.
Okay.
Valley Regional Healthcare is a broad spectrum. We have primary and specialty clinics. We have the hospital. We have Connecticut Valley Home Care, which is a home health and hospice agency. And then we also own part of Summercrest in Newport. So
it's a really complex operation that's not just, when we say Valley Regional, it's more than the hospital.
Absolutely, and as a matter of fact, the hospital, which has been and will be for a little while longer a dominant player in what and who we are, the future of healthcare is that hospitals will become less and less of the provider of healthcare. The idea is that hospital care is expensive, and how do we get folks out of the hospital or prevent them from coming to the hospital? And it's really about driving population health. Our strategic plan looks at, rather than being all things to all people in Sullivan County, our market area will be much bigger in the future. It'll be the Upper Valley and maybe beyond, but a more narrow scope. And how we connect with other healthcare providers in the Upper Valley to become specialists at certain areas. I think as I look at what every community needs locally, they need primary care, they need urgent care, they need emergent care. If you get beyond the money part, those are things that really need to be provided locally. If you go to the next step, then there's regionally. Well, maybe diagnostics and lab work and radiology and surgery and all the things that drive money today, tomorrow as the payment system changes, will become less important to have locally, but still within an easy reach, maybe within a half hour, 45-minute drive.
So people can drive for some of the specialty areas, but they want their local doctor to be able to go in when they're not feeling well.
Yeah, and I think the Upper Valley is a perfect breeding ground for what the future of healthcare is. We have very progressive healthcare leaders, starting, of course, with Dartmouth-Hitchcock Medical Center, but Mount Ascutney, New London, Springfield, Cheshire, Valley Regional, we all work collaboratively. We used to compete, and the idea of competing is gone. And we need to work together to figure out what services we're going to provide, try to minimize the overlap. That creates a more efficient system that will help us reduce the price, reduce the cost of care.
So some of the hospitals you mentioned, New London, and I think maybe you didn't mention, I don't know, with Alice Peck Day, I know, they're part of the Dartmouth sort of network, or so is that part of your plan?
Yeah, I mean, right now, officially, New London Hospital and Mount Ascutney Hospital are legal affiliates of Dartmouth-Hitchcock Medical Center.
And others are looking at
Alice Peck Day and Cheshire are in the process.
Mm-hmm.
The process is pretty lengthy. We are taking a look at affiliation, and it's our responsibility to look at all the options that we have. So we're looking across the region and trying to figure out what would be best for the citizens of this area. I think Dartmouth-Hitchcock is a natural, obvious solution. It may not be the solution that's chosen, and that's a process we have to look internally.
And so if that were a process that you move forward, obviously that wouldn't be Dartmouth taking over Valley Regional. It would be a partnership of some sort.
Right. There's a variety of business models that you can mm-hmm. choose with affiliation. In this region, the models that have been used are a lot of local control. Still a local board of trustees with some Dartmouth affiliates or Dartmouth staff being on that board. But decisions get made local, providers are local, and it has actually enhanced the services. They have brought more services locally. So we have that now. We have one member of the Dartmouth-Hitchcock family on our board of trustees, and that was through what we call a management service agreement. Most people know I'm actually a Dartmouth-Hitchcock employee, and through a management contract, I'm the CEO of Valley Regional. Now I'm still in this position at the will of the Valley Regional trustees, but part of that agreement put one person from Dartmouth on the board, and that's actually been a great help to me as a CEO, but also to our organization and our community. We've enhanced the number of specialists that are local, You don't have to drive to Lebanon for that, and it's just going to continue to grow. So that network and that collaboration has been in the background for many, many years, and now it's really coming to the foreground. Everything that we do, every project, every opportunity, we reach out to the other hospitals and healthcare providers and say, how can we do this together?
Okay, well, we're out of time in this segment.